The Gwinnett County Health Center is now joining a statewide campaign called Compassion Heals. The campaign is designed to connect uninsured people with medical and dental services while raising awareness about the need for charitable health care. Joining us right now to talk all about it is Shameka Allen, the CEO of Good Samaritan Health Centers of Gwinnett. Shameka, thank you so much for being with us.
Thank you for having me.
All right, so let's start here. This campaign, Compassion Heals, what's it all about?
So, Compassion Heals is a campaign that was orchestrated by uh, the leadership of Georgia Charitable Care Network, which is led by Executive Director Donna Looper. And it's designed to create this organization or consistency around the resources that are available for those that are in need of healthcare that are uninsured and have very, very low access to insurance. And so it kind of came together and we kind of started discussing ways that we could let the community know that we were there and available and had the resources to offer.
And talk about those resources, talk about being there in Gwinnett County. Specifically, what services, what resources do you offer at Good Samaritan of Gwinnett?
So, Good Samaritan Gwinnett offers actually primary medical and dental service to anyone that is uninsured. So, we pretty much treat anything that you would go to your regular primary care provider if you had insurance, all sorts of chronic disease, cough, cold, strep throat. We offer school vaccinations. And so, again, a full service primary care offer. And we also have a full service dental clinic. And so, obviously that's very, very important to your overall health as well. So, general dental services, cleaning, root canals, mostly anything that you can get from a general dentistry provider, we also offer at discounted rates for those that are uninsured.
You get into my next question perfectly there. I'm sure you guys get these questions too. I suspect anybody watching right now who may be hearing this, and if they're in a position where they are uninsured or underinsured even, this may sound really appealing to them as an opportunity to get health care and dental care. But I suspect they also would be thinking, okay, if I do go, how much would it cost me? Can you shine a little bit more light on how the cost breakdown works for somebody who wants to take advantage of the services you offer?
Absolutely. So our costs are generally about 50 to 60% lower than what you will find in the market. And so we do thorough reviews of what, most primary care physicians and what dental offices are asking for services. And our costs are generally about half of that. And it is going to depend on what you are seen for. And the general appointment is $110 generally for the first medical appointment, and the first dental appointment is about 125 depending on what you need to be seen for, and that can go as low as $50 in dental. And then the prices are going to absolutely go down from there depending on how consistent you are with your follow-ups, how good you are about taking your medications. And so we definitely try to make our prices fair and keep in mind that those who are coming to us for services often do not have a lot of excess funds for healthcare. Keeping that in mind, it is quality care for what we consider to be an affordable price. And it's offered across the board, again, to anyone who doesn't have insurance.
There are more than 1 million Georgians who are uninsured. In your work, in the work of Good Sam, what does that look like at a person-to-person level when people come into your office, when they come in seeking help? What is the human impact of more than 1 million people being uninsured in Georgia?
It definitely has an impact. I think the first thing you see sometimes is an overall sense of panic. Because people don't think that they are going to have the necessary resources to care for themselves. They may feel as though a lot of our patients are choosing between going to the doctor and paying rent or having food on the table. It's just some very, very tough choices that a lot of people in our population have to face. And it also means specialty care is an obstacle too, because even though they may be able to afford our services, trying to go to the next level if they need specialty care is often a huge barrier to care. And this is what we see both on the medical and the dental side. And so I'm very, very proud of my team here. We utilize a lot of different resources in the community. We walk alongside the patient in the journey to find that next step of care if it's something that we can't provide. But there is a very, very strong human element involved. And it's really just fear. Again, there's just a lot of fear about, what do I do? And a lot of times I tell people, you don't know about our services until you need them, right? And so I think just knowing that there is a place in the community where you can get a consistent provider and consistent care, I hope brings people a little bit of peace and calm when they're finding themselves in a difficult situation.
The campaign that you are a part of right now, it's called Compassion Heals. One of the goals is shining a light and raising awareness on charitable healthcare for people who want to help out. They want to be a part of this campaign, who might be watching right now. What can they do?
Yeah, for sure. If you would like to be a part of this campaign, you can certainly go to our website at www.goodsamgwinnett.org. There is information about our services and what we offer, as well as more information on the Charitable Care Network. And a lot of people don't know that there are over 90 clinics involved in our community. And so wherever you live in the metro area, if you're not close to Gwinnett, there are services available to you near closer where you live. So I would encourage any of your viewers to go to our website and check out Good Sam Gwinnett. And if you look on our webpage, there is information there about the Compassion Campaign as well.
All right, Shameka, we are short on time. One last question for you to follow up on the last one here. Remind us one more time the web address people can go to learn more about what y'all do, and if they're so inclined, how they can help out.
Yes, that's www.goodsamgwinnett.org.
All right, Shameka Allen, CEO of Good Samaritan Health Centers of Gwinnett. Thank you so much for your time and your perspective. We really appreciate it.